Hi, my name is Kaya. I'll be your nurse today. How are you? Good. Can I get your name and date of birth? Okay, I'm going to check your list. Okay, your name and date of birth. Perfect. Okay, Mr. Newman. So today we have an order for NG tube, if that's okay with you. So we're going to go over a couple of things. I'll ask you some questions and we'll get started. But first, I'm going to lift up your bed to high Fowler's position. So I'm going to get you up. Have you had any surgeries such as throat, stomach? No. Okay. Any septum deviation? No. Any trouble swallowing? No. If I needed to, I would do a swallow test to assess myself. Okay. So, before I start, just want to let you know what I have. I have the bucket. So this bucket will be for you in case you need to feel like you need to vomit. We'll set that here between the legs. Then we also have a towel for the patient. So during this, to make sure that there's no messes or anything, that it gets taken care of. I'll put this across your chest for you. Also have my pen light. I also have my NG tube. I also have water for the patient to drink. Some tape. The acid, the pH strips, then some lube, and then the syringe to suction some of the acid, and then a suction, just in case, if the patient is unconscious and might need to suction them and stuff like that. So I'm gonna get started. So I'm gonna start with assessing my patient's nose. And this should help you. It might be a little bit uncomfortable. We're going to try some things like taking deep breaths and doing some things to help you. Okay. All right, so I'm going to have you, once I put my finger over your nose, I'll have you breathe in and out just to make sure that you breathe. Ready? Perfect. Perfect. And I'm also going to check the nose to make sure there's no deviation or anything. Perfect. Thank you. Open eye. Check for any lesions in the mouth or anything like that. Perfect. Okay, so now we're going to get started. I'm going to prepare my tape for when the NG tube is out. Split this one in half for the nose. Okay, perfect. Then I'm starting opening my NG tube packaging. If you feel sick at any point, let me know if you feel comfortable. Alright, so now I'm going to measure the tubing to the patient's nose. So I'm going to start with nose to top of the ear, and I'm going to go down to the xiphoid process. So that's about 55. And then I'm going to just measure twice just in case. So I'm going to start the nose, top of the ear, down to the xiphoid process. Okay, so that was about 55. So I'm going to take this point and I'm going to take a piece of tape and mark it.
Claire? Is Claire
So
not
as
in
I'm...
here?
We can start over.
No, it's okay. Go ahead.
So after I mark this, it's about 55. I want to make sure I keep in mind that I'm looking at it, so when I'm putting it down the patient's throat, that I stop at that marking. So now I'm going to kind of wrap it around to give it a little give. And I'm going to take the loop. And then I'm going to put this on. Trash. And I make sure that there's lube on this so it's easy to go down the patient's throat. Okay, And as we're doing this, you can go ahead and take deep breaths so that when it's going down, it's easier for you. Ready? Here we go. I'm also going to have the patient take a drink of water to help the NG tube go down. Perfect. I'm also going to check to make sure it's not coiling in the mouth. And if I feel a little give, I kind of want to stop a little bit and make sure that it's going down fine. Okay, perfect. And I'm going to take a piece of tape just to hold it there for the moment. Then I'm going to take my syringe, put it here, get some of the acid. Put it in the cup. pH should be lower than 4 to make sure that it's acidic. And then after that, I'm going to attach this tubing to the suction machine. Make sure there's no creases or anything. I'm going to do it intermediate. Perfect. And then now I'm going to secure the NG tube. Now I'll kind of fix it so it's not interfering with the other piece of tape. Take this towel off. Now it's secured to the gown. Perfect. And then I would just check on the patient in like 10 to 15 minutes to make sure everything's going good. And that's the end of my NG tube video.